So the reason a patient would benefit from coming to Siteman Kids is because we are networked with the different consortia and the national treatment protocols. So if there is a new intervention that offers the possibility of better hope for a disorder, we are able to give them that state-of-the-art care, but they also would get it in a setting that has a variety of subspecialties. We can rely on, say, the cardiologist, the pulmonologist, the pediatric surgeon. All these specialties are so used to dealing with children and know what is best for them. So we make use of all the subspecialties, and then we make use of all the ancillary supportive care that we have available for them. Siteman Kids is that package that you would need to get through this a serious disorder. We often spend many hours talking to parents, grandparents, relatives to make sure that they understand not everybody can be treated the same way. You know, what the risks are, how intense do we need to get, and why we need to do the things we are planning to do. I think the more they understand the disease, the more they understand what we've tested and what those results are, the better it is for them to be prepared about what's to come and how best to support their patient. Now, once we have done that, once they have gotten the medical aspect of it, we then have them also talk to our other extended services. Psychologists, for example, they are more prone to tell them, here's what's bothering me. I got to look after this house and, these two other kids, and how do I give them the support that they need when I'm taking care of a patient who needs all my time and energy. And we help them through that. We help them deal with the siblings. We actually bring in the siblings to talk with them too, to help them understand what's going to happen, what's going to go, how the treatment is going to go. The team gets to know the siblings, the family members, the extended family members, so that we can support them as best as as possible. Every family needs a different level of support, and our job is to find out what they need and what would help them the best. So Dear Dogs is a program that has trained dogs who are used to having their time with patients and supporting them in the best possible way. And when I had a patient who was very nervous about a blood draw, an IV needle placement, the dog got up on the chair and held out a paw. And the patient looked at this puppy and got on the next chair and held out her hand. And the procedure went like magic. So I think they have a huge role to play, because who doesn't like, a gentle dog just being there with them, giving them company. And we do definitely, make use of our dogs and our therapists both together, because our therapists actually train the dogs and bring them over and know exactly who could benefit from which, intervention at what time. They make sure that their time in clinic is well spent according to them. As we are, either infusing a product, we're giving blood, or we are giving some therapy, what they come and look forward to is all the other things that happen on the side in clinic. So the most rewarding part of what I do is to see children finish up their treatment, get back to their life, get back to school, get back to their extracurricular activities, and then send me invitations for like prom, or a wedding, or a picture of their baby, or say, hey, I'm getting married. It's actually 150 miles away, but it would be great if you could come, Those are the most rewarding experiences that I've had. I love to watch them grow and move on with their life, leave this treatment part back, hopefully with no effects, later. A lot of these children, if they're older, for a long time, don't forget that they've had to come to clinic every week or every month and, be on follow-up and see us and have procedures and so on. But I think as time goes on, they learn to move on with their life and tell us, come back to tell us. What I remember about this is mostly the puppy that came to see me or the games I used to play. And that's actually very, heartening to listen to. I love that.